Secretary Sajid Javid, good morning to you.
Yeah, good morning.
Thank you very much indeed. Unfortunately, not got you on video. I think you're travelling in your car, being waylaid by a protester.
Yeah, but I'm not going to have anything stop me from talking to you and your listeners.
Fine. Well, my listeners are delighted to hear from you. Let's talk about this massive tax rise on ordinary people, working age people, even the lowest earners. Average earner, £255 a year tax rise. What are they going to get in return?
Well, Julie, I think it's fair that we all rely on the NHS, and whether it's us for adult social care or our elderly relatives, we all want a proper and dignified adult social care system. That's what we all get out of this new levy, which is, I think, absolutely the responsible thing to do to meet the challenges that we face, especially those that have been created by the global pandemic. So if I just point to the NHS first, that we've all seen the waiting list rise for the NHS. People stayed back during the height of COVID. I think everyone understands that. It means that there's more demand than ever before. And I was told when I came into this job a couple of months ago that the waiting list, if it was business as usual, could be as high as 13 million. I'm not going to stand back and let that happen. All your listeners rely on the NHS. We want it to be there for us all, world class and free at the point of use, paid out of general taxation. And this ensures that the NHS is going to be there working for us all.
Well, we were told this is about social care funding reform, but most of the money, in fact, pretty much all the money for the first 3 years. But virtually all the money is going to go to the NHS for the first few years, and your pittance going to social care. Are you honestly saying that in 3 years' time we're going to have tackled that backlog of all those people who've missed care? I mean, let's face it, you and I both know some of those people will have died before they get their care. But are we saying that's going to be over and done with, and then all of that money is going to go to social care? Or is it going to stay in the NHS?
It's as it sounds, it's a levy for both. And so the money, as anyone would expect, should be used by both for what's actually needed. I think people would understand that over the next 2 or 3 years, the biggest demand is in terms of new funding is for the NHS to deal with that backlog and to properly tackle it. But over time, the amount of money that will go into the adult social care system will increase. But even during the next 3 years, it's going to be at least 5.4 billion. And that's extra money. And by the way, that's on top of the 20 billion or so that is already spent by local authorities on adult social care. But what this extra money will do is pay for the new cap on no one will have to face more than £86,000 in total in their lifetime of social care costs. It will mean a more generous means testing system that will help most people. And also it means that we can fund local authorities to both pay what's called a fairer cost of care and also support workers in the care services with their workplace training, some 500 million for that.
I mean, it all sounds really good. When you say 5.4 billion over 3 years, it's 1.8 billion a year. 2.5 billion of that is taken up in covering that cap on costs. Just 2.9 billion for actual care over 3 years. So less than £1 billion extra a year. Less than £1 billion when you're seeing that we won't have the private residents basically topping up the fees from the local authority residents, which they don't touch the sides of the costs of running those care homes. We've got a shortage of care workers. We're about to lose a load because you're going to insist they're sacked because they haven't had a double vaccine. We're going to still be seeing the same level of crisis in social care in a year's time, 2 years' time, 3 years' time, as we've seen in the last year, aren't we?
No, we're not. We have had a crisis in social care for let's be honest, for more than the last year. There's been a problem I was local government secretary a few years ago. I wanted to then try and bring in these kinds of changes. We couldn't get government agreement. And frankly, the government then wasn't able to make these difficult decisions as the current Prime Minister is willing to confront. But now we are dealing with this long-term crisis that has clearly been exacerbated by the pandemic. I think we all get that. But this 5.4 billion over the next 3 years, that is a huge amount of money. It's the biggest injection over a 3 year period the social care system's ever seen. And as I say, it's on top of what is already being provided. And I think it will absolutely pay for what we set out. After 3 years, more will be needed because that cap will start to sort of bite as people start hitting the cap, and clearly local authorities will have to pay more. But that will come after 3 years, and because of the levy, we are confident it can be met.
Okay, your government did say in the last manifesto, a very specific commitment, you would not raise taxes, national insurance, income tax or VAT. We also had promises that we would learn to live with this pandemic, and learning to live with it means obviously no lockdowns. And yet, of course, we've seen plans that Sage members revealed. There are plans conditional on what happens with cases for a possible lockdown in October. We were told that the vaccines were for adults and we would all have our freedom once over 70s were jabbed. That turned out not to be true. Your own one of your own ministers, Nadeem Sahawi, the vaccine minister, has promised again and again on Twitter, in public and Commons, everywhere, that there wouldn't be vaccine passports, and you're rolling that out. Realistically, can my listeners believe a single word that a government minister says?
Yes, well, there's a lot you've just said there, Julia, to unpack. But let's just start with, you mentioned the manifesto commitment. And in that last general election, I was actually the chancellor that said we won't increase these taxes. And I meant it, but I didn't know, I don't think you knew, or anyone knew, or any of your listeners knew, we're about to face the biggest pandemic the world has seen in our lifetimes. And any responsible government would then respond to that and change course where you need to. And we are not pretending at all that manifesto commitment that you prefer to has not been broken. We're very open about this, but we are explaining why I think it's the job of a responsible government to make the serious decisions, take those difficult decisions, and not avoid meeting the people's priorities. So what I would say to people, and I've had this, a lot of people have asked me in the last 24 hours, rightly so, why don't you just not do this and just leave the NHS where it is, business as usual? I am not going to accept a waiting list of 13 million. That's almost one person in every family. Yeah. It is not acceptable. I believe in the NHS. The NHS needs to be there for all of us for when we need it. And I think most of your listeners believe in the NHS. And that is the job of a responsible government. And so we will be very clear, we'll be frank with the people all the time about the challenges we face, and we will confront them. Okay. And we won't stick doggedly to a manifesto commitment that would have meant more and more people would have died. They would have not got the services that they need. That would have been unacceptable.
Okay, and a lot of people will agree with you on that. A lot of people also might agree on the prospects of lockdowns and vaccines for children and vaccine passports. But why does the government say they're not going to do these things and then they start doing them?
Well, I think you're jumping ahead a bit on something.
Does the government have plans for a lockdown in October?
Well, let's just say you've just mentioned. Let's take it one at a time. You keep throwing up different things. So let me give me a chance to answer some of the points you make. That you mentioned, vaccines for children a couple of times. First of all, our vaccine program has been an enormous success. Yeah. It is our wall of defense, and it is working. It doesn't mean no one's ending up in hospital, but mercifully, it's a lot lower than before because of the vaccines. Now, when it comes to children, for example, we have not made a decision to whether we are or are not going to vaccinate children. We're making plans just in case that's the decision that eventually ends up being made. But we want to listen to the expert advice, and the advice that I was given by what's called the JCVI was that they didn't feel qualified to make the decision on children, and they advised me to ask the chief medical officers of the UK.
They were qualified to advise you, which is all their job is.
Sorry?
They were qualified to advise you, which is all their job is. Look, I know you have to go, so I want to give you a chance to get onto vaccine passports and lockdown, because I know you have to go, and I want to give you a chance to respond.
And on sort of so-called vaccine passports, the only decision we've made so far that we will go ahead with is if it's in a what I think would be a very high-risk setting, and that's nightclubs. And so we will be going ahead with that. We didn't want to do it earlier because we wanted to make sure everyone that might go to a nightclub had the chance to be double vaccinated. So we plan to start that at the end of September, but we'll keep this under review. But this, I make no apologies to the British public for doing what we need to do to continue to protect us from this pandemic, but doing it in a sensible, open way. As you know, one of the first decisions I took was to remove all the social distancing rules, remove the mask mandate and many other changes, but we've got to keep some controls in place to make sure that we are staying on top of this pandemic. So, for example, that's why we still have a testing program so that anyone can walk into a pharmacy and get free tests and things. And we're testing school children as they go back so we can stay on top of this pandemic.
Sajid Javid, Health and Social Secretary, I've kept you over time because lots to get through. Really appreciate you talking to us, and I know my listeners appreciate hearing from you as well. Thank you very much indeed. 9:15 is the time. You're probably shouting at the radio right now. You may have agreed with a lot of what he said, disagreed with a lot of what he said. Unfortunately, we are only given very small time slots, so we unfortunately the minister did get stuck in the building, was unable to come to us sooner. So obviously time was against us. And yes, there are 1,000 more comebacks and questions that one always wants to ask, but are always very, very difficult to get them all in. But really appreciate the minister coming on, at least answering some of those questions and answering them fully.